It's a community health professional munch and mingles. For those of you that this is your first time joining, I just want to give a brief overview of what these are, why we have them, etc. We host them bi-monthly, and we choose the topic and focus area based off of direct feedback from community health professionals like yourself, who are letting us know either topics or issues that they're seeing with the clientele that they're servicing or the neighborhoods that they're in, or if there's a particular resource or tool that they're particularly interested in learning about, and then we design these based off of that. We also, previous to COVID, it was a really great opportunity for networking because it was in person and we'd have something to eat. So we are hopeful to get back there, and we are very thankful to the Northeast New York Coalition for Occupational Safety and Health for joining us today and helping us along that road to getting back to in-person meetings and in-person dining, etc. I know this has been a particular time for everyone, especially with the changing landscape, new variants, how to stay safe, and people are back at work. And what does that look like? How has that changed? What is it going to look like over the next few months? And outside of the variant, flus, stomach viruses, strep, how can we keep ourselves safe? And also, what are our rights in the workplace? And also for employers, what is their responsibility? So I'm going to pass this off to, is it Angela, are you starting off? Rosanna?
Rosanna.
Okay, thank you.
Thank you so much.
Thank you so much, Carrie, and thank you to everyone who's joining us today. My name is Rosanna Cotobatres. I'm the director of NENICOSH, the Northeast New York Coalition for Occupational Safety and Health, and I'm joined by my two colleagues here. I'll let you all introduce yourselves.
Hi, everyone. I'm Angela Castillo Vilches. I am the Health and Safety Program Assistant for NENICOSH. I will be the co-facilitator for this training today. I'm super excited to talk to you about, like Carrie mentioned, your worker rights and your employer responsibilities.
Hi, good afternoon. My name is Dan Vaughn Cherubin, and I'm the Outreach and Training Assistant at NENICOSH, and I'll be providing some support during the training and yeah, sort of learning right alongside y'all. So thanks for having me.
So in the next hour and a half that we're together, we're going to be talking about infectious diseases in the workplace. So we're going to learn what an infectious disease is, how it spreads, and what resources we have to give you in the event that you get exposed or that you get sick. We'll talk about what laws protect workers on the job, specifically related to health and safety. We're also going to touch on employer responsibilities in relation to that, your rights on the job. And we'll talk about public health measures to keep yourself and your family safe. So before we begin, we'd like to ask you if you could unmute yourselves or type through the chat, what's one piece of information that you want to get out of this training? When you got the email from Carrie and HCDI, what attracted you to join us today? And what's one thing that you want to learn after leaving this session? And yes, feel comfortable if you want to speak. We would love to hear your voices. And you can unmute yourselves, or if you want to type it into the chat, that works for us too. And hopefully after this hour and a half that we're together, we'll be able to answer any questions that you have or any doubts that you have around infectious diseases and COVID-19. And feel free as we go along, in this training to raise your hand, unmute yourself if you have any questions, or type it in through the chat. We really want to make this interactive so that you get a lot out of this. So I hear that Susan wants to learn how to keep seniors safe during a social adult day program, even when under a mask mandate. Great, so that's a good one. So we'll talk about the different procedures that we know are in place to keep people safe and what would be the best recommendations for situations like that. Right, so I see that somebody else also typed, hoping to respond to concerns from the community regarding job security since there is no longer a COVID sick bank or maybe paid family leave. Employees are nervous to call out even when they're sick since they worry that their job won't be secure. Yeah, so that we'll touch on that when we talk about policies that can be put in place to accommodate, you know, unfortunate incidents like this, this unprecedented pandemic, and instances where people have to take time off from work. Thank you so much. So we'll begin just so we can start on the same page, talking about what is an infectious disease. So an infectious disease is a disease caused by organisms such as bacteria, viruses, parasites, or fungi, which are transmitted and can make you sick. And so what does this mean? This means that infectious diseases are diseases that enter your body through the form of different living organisms, and they multiply within your body. And Angela will tell us a little bit more about infectious diseases.
All right, I was just typing through the chat. So here are some examples of infectious diseases that we may know of or have heard of. So the first, right, kind of like COVID and what we've been talking about, viruses. Some common viruses that we may have heard of include chickenpox, measles, flu, coronavirus, right? And viruses are things that, right, they can also multiply, right? They can spread easily. They can spread easily between people as well, which is why it's so important for us to get our flu shot every year. Then there's also parasites, right? And these are kind of these little microorganisms that kind of feed off of your body. And, right, parasites, some of these examples can include malaria, dengue fever, which is a very serious type of fever that you can get, and Chagas disease. And again, using the chat or unmuting yourself, what kind of organism spreads parasites? Or let's target it a little bit more. What type of organism would spread, right, malaria or dengue? It's the same insect. It's one that I hate during the summer, right? It's the worst part of the summer. And that would be mosquitoes, right? Mosquitoes can spread these infectious diseases, right? Because they're, you know, puncturing your skin and then puncturing other people's skin. Additionally, we also have to watch out for bacteria, right? And bacteria can include E. coli, salmonella, cholera in some very extreme cases, right? This is bacteria that'll grow on, you know, again, like other living organisms. So E. coli is something that can unfortunately be found in things like lettuce, right? Or other types of like produce. Salmonella, we know that we can get from, you know, raw egg or raw meat if it's not properly cooked, or if we don't wash our hands right after touching the meat. And we know, you know, cholera is a type of infectious disease that reproduces in the water most often. And lastly, we have fungi. So this can include, right, ringworm or histoplasmosis. And basically, right, this is like a type of mold that kind of forms on the body. But these are all examples of infectious diseases, just to show you that infectious diseases have been around for a very long time. And so, you know, now we're talking a lot about it because of COVID-19, but you know, this is a conversation that, you know, we should continue to have past, you know, our fear of COVID-19. So there are a couple different ways that you can be transmitted an infectious disease. Here are some of these ways that it can be transmitted. So it can be transmitted through environmental factors, right? It can go through the wind or the air. We know that's the truth for airborne diseases, which we'll talk about in a little bit. COVID-19 is an airborne disease, so we know that it is transmitted through the air. Additionally, some other types of ways can be through water, transmission through animals, right? As I mentioned before, mosquitoes with malaria and dengue. Fleas, right? Fleas brought the bubonic plague, and you know, more specifically for something more recent, right? Ticks. Ticks can have Lyme disease, and that's something that we have to watch out for every summer when we go and work outside, or even, you know, just run through the grass. And then there's also human transmission, right? Airborne, again, we can get it through the air because someone else is infected and they infect the air and we breathe that air in, right? We can also be infected through droplets. And there's, you know, 2 different types of droplets that we'll talk about. Both can carry infectious diseases. Obviously, direct contact, right? If I, you know, touch someone who has an infectious disease or is infected with an infectious disease, I need to be really careful, right? Wash my hands. It could be transmitted that way, and also indirect contact. So, you know, someone else touches or their droplets get on a surface, I touch that surface, and, you know, I may touch my nose, my eyes, my mouth, because I'm unaware that that surface is infected, and that's how it can be transmitted to me. So I mentioned airborne viral diseases, right? So what is an airborne disease? Well, it's a disease that can be transmitted through infected airborne particles. And what are some airborne diseases that we know of? Again, right, we know of COVID-19. That's the one that we've been talking about forever, right? For 2.5 years or 1.5 years now. Actually, though, the common cold is also a right? The common cold is an airborne disease. You can get sick, right? That's how you usually get, you know, the cold is if you have a coworker or a friend who's around you and sick, right? And again, also the flu, which we know can be very serious, and that's, you know, why we continue to mention the flu, because it's very highly contagious through the air. So what is coronavirus? And I know that, right, this is a conversation that we've been having for 1.5 years, but to kind of all be on the same page, as Rosanna mentioned, so coronavirus, you know, is a type of virus. What we know of as SARS-CoV-2, that's what causes COVID-19, okay? So the virus itself is not named COVID-19. COVID-19 is the name of the disease that it causes. So when you're infected with this virus, you are being infected with SARS-CoV-2. Once you have developed the symptoms and you are contagious and infected, then you have COVID-19, all right? And this is a zoonotic disease, which means that the virus mutated from animals to infect humans. So that's just a little bit of background on COVID-19. So how do airborne diseases spread? So here's a nice video to show you what that looks like. So there are respiratory droplets. I mentioned earlier droplets, right? And these respiratory droplets are released when a person coughs or sneezes, right? And they primarily spread through the air. So these are particles that are suspended in the air. When you're talking, when you're singing, when you're coughing, right? Even when you're breathing, these respiratory droplets kind of, right, they populate the air and they stay suspended. So, right, the amount of time and the concentration of infected particles you are exposed to is what's kind of going to determine, right, how sick you get or if you get infected. So here is a little bit of a breakdown of these droplets, okay? So aerosols, these are respiratory droplets that are less than 100 micrometers, right, in diameter, which means that they can remain suspended in the air. Basically, that just means that they're not heavy enough to fall to the ground, right? It's not like when you cough or when you sneeze that you can sometimes see those droplets splash everywhere. I know that's gross, but that's the only way to really explain it, right? These aerosols will stay in the air suspended, and so that's how they infect you. While droplets, right, these are particles that are larger, and, you know, due to air currents, due to, you know, their weight, they fall to the ground in seconds. So that's what you kind of see spray out if you see, you know, if you're coughing or if you're sneezing and you do feel those droplets come out. Okay, both can be infectious. You can get sick from both types of droplets. And so here we wanted to show you a couple of examples of what it looks like to, right, to be infected through the air. Here are a couple of scenarios. So in this first scenario, I wonder if this will let me annotate. Oh, great. So in this first scenario right here that we have a social gathering in a living room, we have patient 0. Patient 0 is not wearing a mask, okay? So after, you know, 4 hours of ventilation, without no ventilation, right? We don't have any windows open. As you can see, the windows are closed. The doors are closed, okay? And at the beginning of the 4 hours, we see that all of these people, no one's infected, right? It seems that there's only one patient that's infected with COVID-19. Well, right after 4 hours of not having a mask and no ventilation, it seems that everyone in the room has been infected. Now, if we move over to the side, right, we'll see here that this is only 4 hours with only masks. So there's no ventilation again, no door open, no window open, right? And that's because, right, we're getting infected because the aerosol droplets, they're staying in the air suspended. So you can have a mask on, but the fact is that the aerosols are polluting the air, right? And so you have a higher risk of being infected. So again, all these people are being infected. We can see that they are color red because, right, they've probably contracted some type of infectious disease, particularly COVID. But here, down here, we have an example of what it looks like when you have proper ventilation, as we can see here, right? The windows are open, the doors are open, right? We have friends over here keeping their distance, wearing a mask. Also, this person, right, keeping their distance, wearing a mask. Here we see that this person is not keeping their distance. And so that's why they're maybe a little pink, right? They might not be sick, or they might be getting sick from patient 0. We see patient 0 is still wearing a mask. So that's why it's so important to have all these factors together, right? The ventilation, the social distancing, and the masks. Because as we can see, this patient 0, they have a mask on. There's ventilation, right? But they're still getting a friend sick, okay? So that's kind of what, this type of infection kind of looks like, right? When we talk about COVID-19 being very infectious, right? Being very contagious, this is what it looks like. Awesome.
And I should say, as Angela's deleting all those marks, that this is the information we had for COVID-19 before the vaccines were released. So obviously now with the vaccines, we would still recommend having ventilation and wearing masks indoors. But obviously the vaccines do provide another layer of protection.
Absolutely. Thank you. And so on top of, worrying about SARS-CoV-2 and, being infected with that, we also have to worry about variants, okay? And so a variant is, every time that a virus spreads, okay, it changes slightly, right? It reproduces and it kind of adapts, right? It adapts to maybe antibodies that may already be there. It adapts to the fact that it's, traveling through, lots of different cities, lots of different countries. So the more community spread there is, the more variations there may be of a virus. Okay, COVID-19 variants are slight variations of the original SARS-CoV-2 virus. So we know that the COVID-19 that was first introduced to us back in February, March of 2020 is not the same SARS-CoV-2, not the same coronavirus that we're seeing today. So some variations allow for the virus to spread more easily or be resistant against treatment, which is why it's so important for us to continue vaccination and to get our booster shots when they're available, because these are just better ways to protect yourself against all these different variants that are popping up. Here at the top, there's a little bit of a visual so that you can see. So the original strain, one person could transmit to 2.5 people. The Alpha variant, which was the variant that came after, one person could transmit to 4 people, and the Delta variant can transmit to 6 people, right? So it kind of gets stronger and more contagious as it keeps moving.
And so obviously this information is very relevant, right? We know that we are experiencing what many are calling the 3rd wave of COVID-19 because of the Delta variant. And also more recently, we are seeing the Omicron variant being identified, not just in other countries, but for the first time here in the US and California just yesterday. So we know that even though, we're still learning a lot about the Omicron variant, there are some things we know about the Delta variant. We know that the Delta variant is more contagious than the original SARS-CoV-2 strain that Angela mentioned. The Delta variant can also result is more likely to result in hospitalization and death. So if you get sick with the Delta variant, you're more likely to experience more serious symptoms and to be hospitalized. People that are vaccinated are less likely to experience infection, hospitalization, and death from the Delta variant. So we know that vaccines do provide an additional layer of protection that can keep you and your community from getting seriously ill. And that's the point that we want to emphasize if we go to the next slide, that there are multiple layers of protection that we can put in place, both in our communities, at the public safety level at large, and then also in our workplaces. So there are things that involve individual responsibilities that we all have, right? So whenever you have a symptom, you would want to make sure that you can stay home, socially distance, right? Not see anyone. Make sure that you wear masks or any kind of face covering, have proper hand hygiene, or whenever you have to cough, coughing into your elbow, right? If you are in a crowded space, trying to limit the time that you spend in that space. And then when we talk about the public health and community responsibilities, we know that we can use tracking and testing to identify cases so that we can quarantine people and prevent the spread. We can use better ventilation, whether that's doing things outdoors, and many of us were doing that in the summer, in the fall, and now in the winter, maybe having better air filtration, and not just having windows open, but actual mechanical filtration, right? Mechanical ventilation. We know that the government and local authorities can do a lot in spreading the message and having financial support for different programs that can help people continue to get better and to deal with the effects of the pandemic. And then, of course, rules around quarantine and isolation, that's at the level of public health, right? We can all do our part to follow those rules whenever we know that we have been exposed. And then that last layer is really the vaccine. So there's this model, the Swiss cheese model, that you can see, you know, if you take a piece of Swiss cheese, right, the holes of the cheese are in all different areas. But if you line up a lot of those layers of cheese together, the virus may penetrate some of those holes, but it won't get through all of them if we have all of those mechanisms in place. And so that's really what we want to emphasize, that it takes a multi-layered approach to protect people in the workplace. And so how contagious is someone that gets sick? Someone that has been infected with the coronavirus may be contagious 48 to 72 hours before they even begin showing symptoms. So that's something that is also very important, that many people can be asymptomatic, so not have any symptoms when they're actually infected. And that's why it's important to follow those quarantine rules and the social distancing as much as possible. It's also important to keep in mind that you can be most contagious 48 hours before any symptoms occur, and you're also highly contagious in the first 5 days after you get symptoms. And this can be different for everyone, but most people stop being contagious around 10 days after they get symptoms. So that's why there's that recommendation to quarantine for 14 days, right? And now we have the added recommendation of getting tested to make sure that you're no longer having the virus in your system. So I see a question on the chat. In April, before I went to Ghana, I took a lifetime yellow fever vaccination. Is that protection from COVID-19? So unfortunately, each vaccine for different diseases, for different illnesses, is very specific to that illness. So if you took a yellow fever vaccine that would be specific to yellow fever, it would protect you from yellow fever, but not from COVID-19. And we know that even now with the variants, there is talk about redeveloping the vaccines to make sure that they can be better equipped at fighting the new variants. So even the COVID-19, let's say Pfizer or Moderna vaccine that someone might have taken in February or March, now we might be hearing that there might be a new type of COVID vaccine to make sure that you have protection from the new variants. So now we want to ask you if you could unmute yourself, or if you want to type it in through the chat. What are some concerns that you've heard, you know, in your work or in your community, among the clients you serve, around getting sick at work? What are some concerns you've heard specific to the pandemic and workplace issues? And again, we want to invite you to feel comfortable unmuting yourself if you want to speak, or to type it in through the chat if that's better for you. So any questions that your clients might have, any questions that your family members or community has?
I know that there are a lot of questions of people who work with, you know, anyone who could be exposed to kids, right? That's something that I've heard a lot about in my community, since, children under 5 are not able to be vaccinated yet. That's a really big concern for some families. I don't know if anyone else has heard of that either, but.
So I see a question around being fully vaccinated and whether the booster is necessary. So the CDC is recommending that people receive a booster shot for COVID-19 6 months after they received their last shot. So if it's been 6 months or more since you received the first and second shot of the vaccine, if you took Pfizer or Moderna, or if you just got the single dose Johnson & Johnson vaccine, after 6 months, it's recommended that you get the booster. And the reason for that is that we are seeing some decreasing effectiveness of the vaccine to protect you from COVID-19. So in around 6 months, the body kind of loses a lot of those antibodies that it creates with the vaccine. So that's why the booster is being asked, or being called for, being necessary now.
Yeah, I like to think of it as almost like a car gas tank, right? You can fill up a tank, which would be the equivalent of being fully vaccinated, right? You drive it around, you take it places, and then after a while, it's empty, right? You need to refill it, kind of in the same way that the booster works, right? After a little while, the vaccine, the original COVID-19 vaccine, won't really protect you against, right, the new forms of the virus. So you kind of have to, right, re-up your body in order to fight this very serious disease, right? Because COVID-19 has some very serious repercussions for the body. So it's almost like, right, again, the flu shot, I think, is a great example that we've all lived through and haven't really had to think twice about, is the fact that every year we have to get the flu shot, in the same way that we'll probably have to do the same for COVID-19.
Yes, thank you, Angela. So if there are no other comments or questions, we can go to the next slide. But again, if you do have anything to add, feel free to add it in through the chat. So who is at risk of getting sick? So we know that everyone is at risk of being infected with COVID-19, and everyone is also at risk of transmitting COVID-19 to others. We know that not everyone's going to show the same symptoms. Some people might not show any symptoms at all, even when they are infected. And those are the cases we really worry about, the asymptomatic spread, right? We know that those who are not vaccinated, the elderly, people with underlying health conditions, and of course, children that can't get vaccinated are most at risk of having serious complications from the disease. And because of that, everyone is responsible for minimizing the spread of COVID-19. And when we talk about workers, talking about COVID-19 in the workplace, we know that there are certain workers that are more at risk of being exposed to COVID-19. So depending on your exposure to people that are infected with the virus. So if you have a higher exposure to people that could be infected, if you're taking care of people in the social service system or doing customer service, anyone that does home healthcare or other types of healthcare, and you're working in person with individuals, or someone that is cleaning up after individuals that are sick, such as janitors or custodial staff members, those people would be highly exposed to particles of the virus, right? And then other people that would also be exposed in the workplace are people that are working in close proximity to each other. So people that are, again, maybe in healthcare or home healthcare, people that are emergency responders, think about people that are traveling in an ambulance altogether, right? Cashiers that are working closely with other people or interacting with the public in that way, and people that are traveling using public transportation, such as the bus, the train, in a confined space where you can't really get out, can't really get as much ventilation. And so in this year and a half, almost 2 years that we've been dealing with the pandemic, we know that there have been different times in the year that we see increases in the number of cases. So you can see from April, March of 2020, right, we started to see a rise right before the summer of 2020. And then again, we saw another spike around the holiday season last year, following when everyone was traveling and, before vaccines were available. And now the third wave that we're seeing is directly related to the Delta variant. So before August or July, we were mostly thinking that things were getting better, people were getting vaccinated, we can do things outdoors, but now we're really seeing that the number of cases is increasing, and especially if you look at, just the number of cases from, let's say, October to now, there's even a little bit of an increase there, and so that's really concerning. So we know that we still need to stay vigilant around COVID-19 and still, wear masks and stay protected as much as we can. So now we want to ask you if you could share what are some things that you are doing to keep yourself and your family or your community safe? What are some things that you've implemented that have helped to keep you safe, or that you're trying to do to keep you and your family safe? And again, we would love to hear from you, hear about your perspective, your experience, and if you wanted to unmute yourself or type it in through the chat, that would be, either one of those would work well. So we know that there's many things that we're all doing differently, right? Many of us are probably joining a lot of these meetings from different spaces, even if maybe some of us are working in the office now. But our work has really changed in this last year and a half since we started the pandemic. So Carrie mentions that she's been keeping windows cracked from the tap so no one gets the breeze directly whenever we have people over. So in social situations, that has definitely had to have some adjustments, right? Wearing masks. Yep, washing hands frequently, that's also helpful. So there were many things that we were, being asked to do in the very beginning of the pandemic, right? And some of those things now have just become habit, like washing our hands. And I see Sylvia mentions that she had a sibling reunion and we were all fully vaccinated except for one sibling. And then she talked and educated her, and now she's vaccinated. So that's great. A lot of those conversations that we're having to have with our friends, our family members. And sometimes we have to even draw the line, right? We have to say, I had a baby in 2020 and I couldn't see people in the first few months. And even if they were vaccinated, we were only doing things outdoors. But if they were not vaccinated, they were definitely not going to see the baby. So, we have to kind of have those difficult conversations and just be firm with each other, and people probably, hopefully understand. Thank you all for sharing.
Okay, so, in addition to speaking about COVID-19 and the ways that we can get sick and protect ourselves, that also goes hand in hand with workplace protections and your rate on the job. We want to make sure that you're staying safe at work too. So who protects workers' safety and health? Well, the Occupational Safety and Health Administration protects private sector workers from being killed or seriously harmed at work. So again, this administration, as we also know it as OSHA. I'm sure that you've all heard of OSHA before. OSHA originally was an act that was passed in the government, federal government, and it basically outlined a couple of rules, standards, as OSHA calls them, right, about how to keep workers safe in the workplace, okay? So this administration and this act is basically protecting workers from getting hurt or dying at work. In addition to, all these protections that OSHA outlines for workers, it also outlines some responsibilities that employers have to provide their employees with working conditions that are free of any known dangers. So what does that mean, right? That means that if an employer knows that there is a danger in the workplace, it is their responsibility to eliminate it or to change it so that it's not a hazard, right, or a danger to workers. So again, OSHA sets and enforces these workplace safety and health standards that include both worker protections and employee responsibilities. And it's important to note that, OSHA protects all workers, right? It protects all workers regardless of immigration status. So we know that all workers in the US are protected under these OSHA rights and standards. And so any workplace that you've ever been in, these employers had these same responsibilities. So the first responsibility that an employer has is called the general duty clause. And that is that employers have to provide their employees with working conditions that are free of known dangers. An example of this can look like, right, maybe a suspicious puddle has appeared overnight in your workplace, right? And maybe there's some wires running through that puddle. Okay, this could be the case for warehouses, right? For restaurants, for healthcare facilities. Okay, and right, you walk in, you see this puddle, you see that someone could slip on it, right? Maybe someone could get electrocuted by trying to move the wires out of the way. So that would not be your responsibility as a worker. That would not be your peers' responsibility to eliminate. That is your employer's responsibility. So in that moment, your employer would jump into action, and they might try to dry out the puddle, or maybe put some type of sign so that workers don't come near the puddle, right? But the point is that they're providing you this workplace that is known, that is free of these known dangers, right? He knows that there is a puddle in the middle of the workplace. They know that it can be hazardous to the worker, and so they're going to do something about it. Okay. And additionally, right, workers have the right to know what types of chemicals and hazards they're working with, right, and to be trained on how to deal with these hazards. So when you work in like a healthcare facility, right, I'm sure you talk about infectious diseases, right? You may talk about needles, right, and how to effectively and safely throw out needles, right, dispose of them. You may learn tactics on how to carry patients in a way that won't, hurt your back. Or you may learn about, the different ways of touching certain chemicals, maybe with extra gloves and masks on. Okay, so it is your right to know the hazards that you're walking into every day at work. All jobs have hazards, right? So it's kind of like your employer, it's their responsibility to outline these hazards to you and to show you, right, how to avoid being hurt by these hazards. There's also the Bloodborne Pathogen Standard, which applies to all workplaces where there is a potential exposure to blood or other potentially infectious materials. And that Bloodborne Pathogen Standard basically outlines that if you're not trained and if you're not qualified to deal with someone else's, right, like blood or infectious materials that may come out of their body, right? So that can include like vomit or other types of secretion, right? That you don't touch it at all. So we know it's something that happens at schools, right? Teachers are not supposed to touch blood if a student, maybe cuts their finger or something like that. And that is because we are assuming that any type of fluid that comes out of the body may be infectious. And so to protect ourselves and protect our peers, right, we're just not going to touch it, and we're going to let someone qualified do that. Okay. Additionally, employers, they have to assess the workplace and identify the hazards in order to provide the PPE necessary. So again, I mentioned chemicals earlier. Chemicals, we know whether you're in sanitation, whether you're cleaning staff, right? It's important that your employer knows what the chemicals are and how they affect your body to be able to protect you. So if we know that there's one chemical that's really, really, really strong, it it irritates the skin, it irritates the eyes and maybe the nose, right? I'm thinking like bleach or ammonia or something like that, right? It's your employer's responsibility to give you gloves that won't disintegrate in the chemical, right? They're strong enough to keep the chemical off of your body. Maybe provide some heavy masks or respirators so that you're not breathing in all of those chemicals. And, if, again, I mentioned the eyes, right? Maybe giving you eye protection from this chemical, okay? So it is your employer's responsibility to not only assess, right, look around the workplace and say, these are the certain hazards that I have, but also to put into action, right, using this PPE, using this personal protective equipment to make sure that, these hazards aren't hurting you. So here are some rights on the job that workers have in the U.S. So all workers in the U.S. have the right to work in a place that is healthy and safe, free of recognized hazards, right? We just spoke about that. Receive training about hazards in your job in a language you understand. So, right, additionally, on top of them, right, assessing these hazards, if there is a language that you prefer to be trained in, that is your right to ask for that training in that language. Okay. So if you're If your first language is Spanish and you think you're going to grasp the information a lot better in Spanish, right? Maybe you're an English language learner, okay? It is your right as a worker to ask for these trainings in Spanish, right? In the language that you'll understand, just so that you can comprehend the hazards that are present in your workplace. You also have the right to go to the bathroom whenever you need, including washing your hands, right? This is one that not a lot of people know. There was, when I was in high school, it was very famous that the Target next door would not allow their employees to go to the bathroom whenever they wanted, right? But you are allowed, especially during COVID-19, right, to go and wash your hands frequently, use the bathroom when you need. You also have the right to receive payment for all your hours worked, right? And overtime pay. So every hour you worked, you should be getting paid for. And if you're not, that's something that you should contact the New York State Department of Labor, which we'll talk about at the end. We'll share all those resources with you. Okay, but for every hour you work, for all the time that you work, you should be getting paid. You're also allowed to refuse work that is dangerous to your health and safety. Okay, so if you know that there is this really, really, really big hazard that's in place in your workplace, and your employer is basically asking you to ignore the fact that it's a hazard and do the task anyways, you are allowed to refuse this work without retaliation. Okay, so you're allowed to say, I could get seriously injured from this task that you're asking me to do. I prefer not to do it. And this, I mean, it's a little bit complicated because you have to do so in good faith, right? It has to be something that is like really hazardous, that could really harm you or injure you. And there's a lot of kind of loopholes through that. But just so you know that, if there is a very serious present hazard, you are allowed to refuse that work. And lastly, you're allowed to use all of your rights as a worker without fear of retaliation. And retaliation is basically when an employer, they discipline you for having brought up maybe a health and safety concern, maybe like a workplace violence concern, right? So retaliation can look like firing you, blacklisting you, right? Reducing your pay, reducing your hours, right? Demoting you. So you're allowed to, complain to your employer. You're allowed to bring up hazards and file complaints with OSHA without, facing this retaliation. And so again, you have some whistleblower protections, okay? So your employer can't legally retaliate against you for exercising your health and safety rights. If you are retaliated against, you must file this type of complaint within 30 days of the action, okay? So you do have a small period of time, right? You have a month in order to file this complaint if you do feel that you've been retaliated against. And this can look like, right, an employer intimidating you, harassing you at work, denying you overtime, demoting you, denying you of your benefits, reassignment affecting prospects for promotion. So reducing pay or hours, right? Or firing or laying off, which is something that we see often. And again, right, this is very illegal, and it's not that it doesn't happen. It's just that we need to know that, this isn't okay for them to do. And so if you do feel like you've been retaliated against, it is 100% worth your while to file a complaint within the 30 days. So we wanted to ask, what are some things that are being done at your job that maybe that you've noticed at other work sites, or that you've heard from maybe friends or family members that they're doing to keep their workers safe? So I know, right, my job is allowing us to work from home, work remotely, right? And that allows us to, right, not be exposed to as many people daily because I can work from home and I'm only exposed to myself and my little dog, right? What are some things that they're doing at your workplace, or maybe that you've heard of? And again, please feel free to unmute yourself. Feel free to type through the chat, whatever floats your boat. So I see Carrie says making masks and hand sanitizer easily available. Absolutely, right? Hand sanitizer at every little station, so that we're, disinfecting our hands. Also, just, it's a lot more effective for you to wash your hands with water and soap whenever you can. But hand sanitizer is a great substitute. Extra caution signs, gloves and sanitizer, absolutely. Temp and symptom checks. Yep, that's one that, we've seen in a lot of workplaces. So they'll have that like thermometer that they kind of put up here to your head. Absolutely. Has anyone had any kind of change in the way that you report to your boss, or maybe some protections if you do feel sick? You know, we've seen that some employers are starting to take more seriously when an employee says, you know, I'm not feeling super great today. You know, some employers have kind of moved into saying, stay at home, which is not the case. You know, before the pandemic, we were all going to work and school, you know, with a cold, with a cough, filling out the medical questionnaire every morning, right? Yeah, to ask, you know, what symptoms, what are you feeling, right? It's a great way to kind of trace what these symptoms look like in the workplace. You never know if there's an outbreak, and so having those questionnaires, right, kind of will help you zero down on patient zero. All right, well, thank you so much for these answers. These are all great. And I hope that, you know, your employers continue to improve the workplace protocols.
So now we're going to talk about what are some procedures that can be put in place to keep yourself safe and healthy on the job. And just remember that, you know, we're conveying this information to you with the hope that you'll be able to advocate for yourselves in the workplace if these things are not being met, or if you feel like your health and your safety is being put on the line. And so there are certain things that employers have to do in relation to COVID-19. They must develop an infectious disease preparedness and response plan. So this is something that was recommended, you know, even before the pandemic. The employers should have had this in place. Obviously, no one was prepared for this pandemic and the level of exposure that we had. But now in New York State, it is a law that they have to have in place infectious disease preparedness plans. They must follow federal, state, and local mandates, and they have to follow these as the epidemic or the pandemic, as the disaster evolves. During this time, even though we are in the middle of a pandemic, they still have to continue following OSHA standards and other labor laws. So just because we're in the middle of a pandemic or a national emergency doesn't mean that, you know, they won't follow the regular OSHA standards that apply, or that they won't pay you for all the hours that you work, or, you know, we're not going to be seeing any child labor violations. There shouldn't be any just because we're in the middle of an emergency. Employers also have to put in place a basic infection prevention measure. So as you mentioned, you know, having temperature checks, having surveys that ask you for any symptoms that you have before you enter the building, making sure that there is a more regular schedule for cleaning and sanitizing surfaces, right? That would be just a basic way of preventing infection. They also have to develop, implement, and communicate any workplace flexibilities and other protections. So this is where we would see that, you know, if they have in place flexible timing or different schedules, maybe staggered shifts, or different accommodations that they might be able to offer to make sure that not everyone is going into the office, or that the work is being done in a more safe way. And they have to put in place other types of workplace controls. And so we'll talk about that next, what those workplace controls look like. So when we talk about controlling for hazards in the workplace, whether it's an infectious disease hazard or a chemical hazard or any other type of hazard, we think of this hierarchy of controls. And we really want the most effective method to be put in place before we go down the list to the least effective method. So the most effective way of controlling for hazards, making sure that no one gets sick, that no one gets hurt on the job, is to eliminate or remove the hazard. We can't eliminate or remove the hazard of the infectious disease, but one thing that we could do is, you know, isolating ourselves. That would be a way of eliminating our exposure to the hazard. So that's why the quarantine and social isolation rules were really put in place early on, right? When we go down the list, we see that substitution is another way of replacing the hazard and making sure that people stay safe. That's something that we typically see with chemicals. So if a chemical that's being used to clean or disinfect around COVID-19 areas, then, you know, if that chemical is very hazardous, you want to make sure that you use something that still gets the job done, that can still sanitize and disinfect, but that won't harm the workers as much. So it's a little safer to use. As we move down the list, we have engineering control. So that's using machines, technology, or other types of engineering to remove the hazard from where people are. So that would be things like physical barriers that many of us have seen at supermarkets or other stores. It would be things like ventilation or HEPA filters, better filtration to filter the air. Okay, so using machines to eliminate the hazard from the environment. And then we have administrative controls, and that's a lot of what we've been seeing, those workplace flexibilities, workplace rules, changing the way that people work so that people know how to stay safe during this pandemic. And then finally, the last layer of protection is the PPE, or the personal protective equipment. And even though we are all being asked to wear masks and respirators, the reason that the PPE is the least effective method of control is that it requires each individual to wear the PPE to make sure that they have it, first of all, right? And then make sure that they're wearing it correctly to make sure that it's not damaged, right? So there's a lot more space for human error when you have the requirement be that PPE is worn and nothing else is done to eliminate the hazard or to remove the hazard. And so some more examples of workplace controls that were mentioned, as I said, engineering controls would be things that distance the hazard from workers, things like ventilation, HEPA filters, those physical barriers, the shields or the sneeze guards, the plastic barriers between cashiers and yourselves, right? Administrative controls would be things like encouraging people that are having any symptoms to stay home, or allowing people to work from home if that's something that your industry can accommodate. To remove non-essential work, especially non-essential travel that might put people in contact with others. To have work rules for any individuals that are still having to report into work, and to have training and education with up-to-date information on what to do as the pandemic evolves. And then again, the PPE is the last layer of control that protect each individual worker if worn correctly. And so other workplace policies that can be adjusted to reduce exposure, again, is making sure that people have access to paid sick time and that there are no threats of losing the job or any kind of retaliation for taking time off. Enabling people to reduce the level of travel that they do, or to reduce the face-to-face contact that they have with other clients or other customers. Having a more regular cleaning and disinfecting routine so that areas that are touched frequently are more regularly cleaned and disinfected. Again, as Angela mentioned, the bathroom breaks and more frequent breaks to wash your hands or to sanitize your hands. And that's especially important for essential workers that are interacting a lot more with the public. And then again, the training is really important. Training such as this, or training that's more specific, tailored to your particular jobs, that train workers on the emerging hazards and the workplace policies to accommodate for that new hazard. And so how do you know if you have to wear personal protective equipment at your job? So it's your employer's responsibility to assess what hazards you are exposed to in all the tasks that you have to do in your job. So they have to look at all the different tasks that you're required to do and make sure that, if while doing any of those tasks, you are required to wear PPE, they would let you know. If you have to wear PPE, the employer is required to select the appropriate type of PPE for the job and for the level of risk that you're doing. So someone that's working in healthcare might be wearing a gown like you see here, a respirator, some eye protection and gloves, but that's not necessarily the case for someone that is working in a medical office, right? Or someone that's working in a supermarket. The type of industry and the type of PPE would vary by industry. The employer is also responsible for training workers on how to properly use PPE, how to put it on, how to take it off, how to take care of it and maintain it, how to clean it if it's a type of equipment that has to be cleaned regularly and that's not disposable. And it's important to know that PPE has to be provided by the employer at no cost to the workers. So if you ever hear of anyone that is being asked to provide for their own PPE, or if the PPE is being taken out of, the cost of the PPE is taken out of their wages or anything like that, that is not allowed. It's something that the employer has to be providing to workers, and they have to have enough of it so that people can replace the PPE when it wears down or when it breaks. And they have to have enough, to accommodate different sizes as well.
So what is the difference between face masks and respirators? So, we've been using this PPE for 1.5 years now, just going into stores, right? Going into public spaces. But what is the difference between having, a surgical face mask or maybe, a homemade face mask versus having a respirator? So the first and most important would be the fact that a face mask will protect others from you. So let's say that you are someone who may be infected with the flu or with COVID-19, right? So by wearing a face mask, you're protecting others from getting sick, right? But it doesn't offer any type of filtration for any type of germs that would be, coming in as you're breathing. So again, right, it kind of it conceals it conceals droplets that may infect others, but ultimately will it be a huge amount of protection for you? Probably not, right? And so the face mask isn't fit tested, so there's no seal. Okay, so when you do have the face mask on, right, a lot of times you can stick your fingers in between, or it'll be folded. Sometimes people will twist them and kind of create that fold already that's peeking out, right? So we know that by not having that seal, that means that there is infectious particles that can come in from the sides, maybe from underneath the chin and from the top of the nose. Okay. And with the respirator, as we've seen with N95 respirators, those are ones that have been very common during the pandemic, right? This protects the wearer from being infected, so it protects you from anyone else around you who may be sick, but it also protects everyone else around you from, from the possibility of you being sick, okay? So this offers a 95% filtration for these germs, which is why it's called the N95. And so this respirator is fit tested, okay? So there is a seal around the face. So usually with an N95, you'll have, a strap all the way up here into the top, right? And a strap all the way down here. And what that'll provide is enough suspension, right? Enough pressure for it to have a seal around your face, okay? That's why it's so important that if you're gonna wear a respirator, you shave any facial hair that may be present, right? That may stop the seal from actually sealing on your face. Kind of the goal with the respirator is that no air is coming in through the sides or from the top or from the bottom, okay? So this will literally seal on your face. And so all the air that's happening is happening through the filtration system and right through your mouth and your nose. And lastly, we wanted to share some health and safety resources with you. So we mentioned OSHA earlier. Here we have the OSHA phone number, as well as their online website. And you can file a complaint in 4 different ways. You can call OSHA using that phone number, or finding the local number. There is an Albany chapter of OSHA, an Albany office. You can also file a complaint online using that website that we've provided for you. Additionally, you may fax a complaint or do it in person. Okay, so there are offices that you can go file these complaints in person. Of course, I would check probably, the hours of operation given the pandemic, but that is, a service that you may have if you'd like that. Additionally, we've provided the numbers for the New York State Department of Labor in any other case. Also the New York State Workers' Compensation Board, which is a type of insurance that that your employer is supposed to have in the case that you do get sick or hurt at work and you need medical coverage, right? So if you do get injured at work and you need to go see a doctor, it would be workers' compensation that would compensate you for right, any type of bill that you get from the doctor. Additionally, right, at the top right, we have our phone number and our website. Please feel free to hop on our website, see the different resources we have. We have lots of information for Know Your Rights, so all of this information that we've provided to you today. We have some young worker information for any young workers that may be in your life, maybe your children, maybe family members, maybe neighbors, right? We also have here listed the different types of COSHs that we have, the different offices that we have in New York State. So if you are in a different part of New York State, you're not from the capital region, these would be the COSHs to reach out to for your local COSH. And with that,
Go ahead, Angela.
I was gonna say, additionally, if there are any questions, we can take that now. Again, feel free to unmute yourself or to type through the chat. There are any questions, any lasting impressions or comments?
And we are available also to deliver training like this if your organization wanted to receive a more in-depth training on either general health and safety hazards or infectious disease hazards. We're happy to also share our contact information so you can get in touch with us and to schedule a training with us.
That would be terrific. It's brought up, about youth and workers, a lot of the after-school programs employ teens and high schoolers, and I think that information would be really helpful. So we'll definitely shoot those out to our partners as well.
Great,
Thank you,
I've put in our email as well for anyone to email us if you are looking for this information. And if, before logging off this call, before, closing out with our information, at least, we would really appreciate it if you could take 5 minutes to fill out our evaluation form. This form will really help us improve our trainings while also, giving us a grasp for, how well did we deliver this information today? I know this, some of this information might be information that you've heard already. Maybe you've heard hopefully you've heard some new information today. But, if you could take, those 5 minutes to fill this out, we would really greatly appreciate it.
Thank you so much. And I'll also send that link along as well so that if people had to rush off the call today, they'll have it when I send the materials out next week. And if there's any other materials that you feel is important or with this changing landscape that comes out after this call, please send those along to me. I'll make sure to get them to the group. But thank you so much for your time today for this great presentation. Thank you all who attended. I know that you guys are all super busy doing tremendous work in the community. So thank you, thank you. And if we don't see or speak to each other in the next few weeks, I hope you all enjoy a healthy and happy holiday. Thank you, everyone.
Thank you so much.
Thank you. Have a great holiday, everyone.